Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Hi, welcome to the podcast. A common question that I get is, do I even need a pap smear? So I thought it would be something that we should talk about here. First of all, what are the guidelines? And before we even talk about guidelines, what do guidelines even mean? So as a board-certified OBGYN, we get guidelines or practice recommendations from ACOG, which is the American College of Obstetrics and Gynecology. There are also other guidelines from the CDC. You've probably heard about that now that coronavirus has been around. World Health Organization guidelines, the U.S. Preventative Task Force. So lots of organizations put out guidelines, and they're really, I would call, suggestions. They're not rules, but it gives us an idea of how we should consider practicing medicine. So the guidelines from ACOG say that you don't need a pap smear until you're 21, regardless if you're sexually active or not. And then from age 21 to 29 to get a pap smear every 3 years with cytology alone. So what does that mean? Let's just go back and talk about what happens when you actually have a pap smear. So when you have a pap smear, your medical provider will put that shiny metal, usually cold, kind of clamp looking thing into the vagina and open it up. And that's what all of us really hate. I got to be honest. I'm an OBGYN, but I am the worst patient. Even when it comes to getting a pap smear, my hands start getting sweaty. I start getting nervous. I want to clamp my butt down because I just don't like it. But that's what happens that's what we do to get a pap smear. And then once the provider sees your cervix, we take this little spatula and get the cells right on the opening of the cervix. And then we take this other brush. It kind of looks like the brush that you actually use to put mascara on. And we put that inside the opening of the cervix, or what's called the cervical os. And then we put it in this jar with water and send it off to the pathologist. And the pathologist looks at the cells underneath the microscope. So looking at those cells is called cytology. Then women over 30, not only does the pathologist do the cytology, but they also do a culture to see if HPV virus is present. And when we're doing it and looking for HPV, we're looking for high-risk subtypes of HPV. So let's get back to the guidelines. Anyway, nothing recommended if you're less than age 21. Age 21 to 29, cytology alone every 3 years. Age 30 to 65, either cytology alone every 3 years or cytology with co-testing, which means cytology plus HPV screening every 5 years. And then after 65, no pap smears are recommended unless you're at risk. So that's the guidelines from ACOG. The U.S. Preventative Task Force has different guidelines than that say age 30 to 65, you need cytology alone every 3 years, or HPV alone every 5 years. So those are the guidelines. I personally don't follow those guidelines. If a patient asks me, I'll review them and say, if you want to follow those guidelines, I think that that's reasonable. However, I think at an annual exam, at least in my practice, we do more than just a pap smear, and more should happen at the annual exam other than a pap smear. We consider screening for sexually transmitted diseases. We talk about contraception. We usually order screening blood work. Now, in our practice, we usually do a CBC that looks at your red blood cells, white blood cells, platelets. We do a blood test called a comprehensive metabolic panel that looks at your liver, kidneys, electrolytes. I usually do a screening test for thyroid called a TSH, do a cholesterol panel, a fasting insulin, and also a hemoglobin A1C, which is a blood test that looks at your average blood sugar over the past 3 months. Those are the baseline things we do for everybody. For those over 40, we'll also talk about mammograms. For women over 55, in our practice, we also recommend that women get something called a CT calcium score. Now, that's a topic for another day, but that test is looking for calcified plaque. And the reason why we recommend that in our practice is because half of Americans actually die from cardiovascular disease. And the most common way people find out they have cardiovascular disease is sudden death. So that's an out-of-pocket test. In the Cincinnati area, it's about $100. And it's something that we recommend as a screening tool. So in my opinion, we're doing more than just a pap smear at the annual exam. And the other reason is it's usually free. For most people that have commercial insurance, it's about the only thing that's 100% covered or free in medicine. So why not take advantage and get your yearly exam? And if you heard nothing else, is you're more than just a cervix and you're more than just a pap smear. And I highly recommend going to a medical provider for a full checkup and plus or minus the pap smear every year. Hope that helps. Thanks for joining us.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such conditions.